So all of these things
are
are major levers for lowering blood pressure.
They are.
This is Generation Health. Every week we bring you the latest in news, cutting-edge research, and time-tested best practices, helping you live a longer, healthier life. PharmD, certified strength conditioning specialist, bespectacled, handsome individual, Dante DiMatteo. How are you, sir?
Thanks, Tyler. Not too bad.
Yeah?
Not too bad. I brought the glasses out today just because I had that sleepy look about me.
Yeah.
I wanted to hide it.
So we're gonna mask
for
it
the viewers. So if this is one maybe to just listen to, not watch, I got this study eyes. We work hard putting this together, and so
it's true.
Sometimes, I show it.
Yeah. You sure it's not cat allergies? I'm just saying it's possible.
Would be devastating. We'd have a real conundrum on our hands with the 3 cats.
Yeah.
So
it's those Western Pennsylvania eyes this time of year.
Those dreary eyes.
Yes, the dreary eyes.
Thanks.
That's the voice of Josiah Schweinberg, our engineer. How are you, sir?
I'm not spectacled.
No.
And I'm doing pretty good.
Good. Excellent. My name is Tyler Andrews. I'm the host. Dante, what are we talking about today?
My favorite. We have a Q&A special. So
it is. It's going to be good. It's going to be good. You got a bunch of good ones here.
No, it's not that I don't appreciate the questions. It's just, it's hard. They're hard, and you want more out of the question. But as Tyler and Josiah have encouraged me, you just have to take it for what it's worth.
Right. Answer the question.
It's just like how they used to teach you how to answer SAT questions.
Yeah.
You're like reading into it all these different ways when really, provide some color.
Yep.
Help some people or not, make some people mad or whatever. However it goes.
Absolutely. But first, let's find out what's new behind the counter. A 57-year-old woman from Wisconsin is expected to make a full recovery after being shot in the posterior by a gun that she was carrying into an MRI. MRIs, or magnetic resonance imaging, are one of the most widely used imaging techniques available to doctors. They provide highly detailed images of the inside of a person's body, particularly their soft tissues like organs that you can't see with an X-ray. And the way they do this, as the name implies, is a combination of magnets and radio resonance to produce the image. Really big magnets. The unnamed 57-year-old woman was given normal warnings before entering the room about removing jewelry, wedding bands, earrings, anything metal on your body needs to be taken off. People with tattoos are warned that the tattoo might itch. I know a guy that had a metal plate in his head and couldn't get an MRI because it would have literally pulled the plate out of his head. Oh, man. So she was given the same warning as everybody else, and according to records, she answered no to all of those questions. Do you have any of these on you? No. They even asked, do you have any...
Right to bear arms.
That's what I was going to say.
They said, do you have any dangerous items like knives or guns on you? And she said no. The amazing thing is, we don't know where she was hiding the gun because she was wearing a standard hospital gown. Yeah, but we do know that this happened. The reason we know about this is because the incident was reported to the FDA's MAUDE database, MAUDE, where medical professionals can report any adverse effects involving devices. And I guess this qualifies. We're not exactly sure how the gun discharged, but clearly it did. And she's expected to make a full recovery. So
did it say what her MRI was for? Did it talk about any of that?
No, it did not. Because there were no...
I remember there was they didn't share obviously any of the personal details.
Yep.
But I remember someone kind of framed this in the way that something that I wanted to talk about actually. Kim
this wasn't supposed to start that, but I'm excited now.
Kim Kardashian, she's been...
This is going great places.
I'm ready. She's been this is all I have because we would have to unpack this a bit further, a bit of a cliffhanger. But she's been endorsing MRIs.
For what?
Exactly. So now people, since the cost has generally kind of come down.
Yeah.
And there are different machines, different levels of MRI machine available, I guess.
Yeah.
Some clearly better than others, some with, magnets.
Stronger magnets.
Anyway, there's somebody out there who's saying that, yeah, go get MRIs. We'll be able to detect tumors or detect issues, detect injuries.
Okay.
Without, almost just like a screening tool.
Okay.
So I know we've alluded to this. I don't know if it was in conversation or even on one of these shows.
Yeah.
But again, there's somebody out there sort of endorsing, you don't need an MRI, but go get one just because you never know what you'll find.
Someone who has massive influence, massive platform, saying, "Hey, go get."
Yeah, and I don't know that Kim K went out and said that per se, but
Right.
I know for a fact that she went and had a curious MRI done. What I'll say is I had an MRI done on my shoulder. I've had multiple done, but most recently on my shoulder.
Yeah.
And it was terrible. They had to put the dye in.
Yeah.
So the arthrogram or whatever. But imagine.
And you have to hold still for
just curiously
a long time
doing that. Yeah. And it was, they gave me these little headphones. I couldn't even hear. All you could hear is the loud sound.
Because it's so loud.
But all that's to say, we probably need to check in on the curious MRI kind of stuff.
We need to look into that. It's not the same as a DEXA scan because DEXAs aren't that invasive. None of it's invasive technically, but it's not interesting. All right. Well,
no, DEXA. You'll get probably some overlap in information, but it's more water content, bone density,
muscle mass, and all that jazz.
Mm-hmm.
Okay. Well, there you go. Anyway, all that is to say, there's the MAUD system. It tracks adverse effects with medical devices, and thanks to that, we know about this lady in Wisconsin.
And if you're curious about an MRI, maybe wait till we talk about it first.
Yeah, there you go. And also, new medical research suggests that owning a cat could double the risk of developing schizophrenia. The meta-analysis published in the Journal of Psychoses and Related Disorders looked at 17 studies published over the last 44 years from 11 different countries. Quoting the study itself, quote, "Our findings support an association between cat exposure and an increased risk of broadly defined schizophrenia-related disorders. It is believed that a parasite called Toxoplasma gondii is responsible. It enters a person's body when they're scratched or bitten by a cat, even playfully, or through contact with the animal's feces. Most people with this parasite in their blood have no symptoms, but it can enter the central nervous system and influence neurotransmitters, leading to the neurological disorders." Thoughts?
What do you think about that? I think this is an assault on his character, if anything.
It's not his fault that he may or may not have Toxoplasma gondii.
Oh man, I would hope not. And I promise we're not making light of this, right?
It is serious, but it has long been accused that cat owners have a higher likelihood of neurological disorders, but it looks like there is some actual, and it's not specifically cat owners, it's people exposed to cats. This is why they're typically put away.
This is Pablo's first episode. It took 41 episodes to get him here.
This is also why you should be watching the show, because if you're not watching, you have no idea what's happening right now.
What does Tyler normally say? If you're only listening, you're missing half the fun.
That's exactly right.
There's no doubt it's fascinating, and there's surely a lot of people that have cats.
Yeah, well, and the point, like it said, most people that do have this parasite in their blood have no impact, no effect whatsoever. But it is interesting that could be related.
Yeah.
There we go. Very serious news segment here in the first part of the year. What are we talking about? We're talking about questions. We've got questions from listeners. Are you ready?
I'm ready.
This is like a quiz in college. If you don't answer these correctly, I already have the answers over here. I have an answer key. And I'm gonna check. No, that's not true. Joni left us a question on YouTube. She said, "Is there an adult RSV, an adult version of RSV? If so, what are the signs and symptoms? What are the treatments? Are there long-term side effects of RSV?" That is a hot topic these days. Okay, so
It is.
RSV, the cat's back again. Oh my goodness.
We opened a can of worms.
We did.
We opened a can of toxoplasma.
Gandhi. Toxoplasma Gandhi.
So the first part of this, is there
an adult version of RSV?
Is there an adult version of RSV? So RSV, respiratory syncytial virus, it's found in all ages. There's an abundance of pathogens that can cause the common cold or common cold symptoms, and RSV is one of them.
Okay.
So the most basic answer is that there's no adult version, there's no kids version. While there are two main subtypes, there's no actual difference in what virus you might be contracting, whether you're an adult or you're, an infant.
So it's not like chicken pox where there's
more
an adult
more
or
nuance
child
in that
version.
case.
It's one issue, one virus. Yeah, it's a
right.
virus.
Right.
But yes,
the genotyping of the virus is, well beyond the scope of answering this question.
Sure.
But again, for all intents and purposes, there's A and B. It seemingly varies which one is the predominant type by season. But again, there's, I couldn't really get a clear signal on, whether A is more serious for kids or more serious in preterm infants or, in 65 plus. I don't think there's a strong signal there. So again, it's just, kind of segues us into more of her question. But in general, what happens is there are just higher risk groups in the population. So because we hear about it often in infants and how severe it can be in infants and in children under 2, let's say, it's just, we assume, it must not be a big issue in adults, but it certainly is a virus that, especially if you're in one of these higher risk groups, which we'll talk about, it can have pretty serious implications.
Okay. So what are the signs and symptoms? Is it just the same as a standard cold for most people?
For the most part, yes. So you'll see fatigue, cough, sore throat. I actually have a lingering cough right now. So could potentially have been a little bit of an RSV exposure at some point, but fatigue, cough, sore throat, congestion, runny nose, headache, fever even. And now with more severe infections, they're often characterized by worsening or worsened versions of those sort of symptoms. So you'll hear somebody's cough not get worse, you'll hear somebody's cough continue to get worse.
Okay.
And then it's often accompanied by wheezing, especially in, young children, you might see that. Shortness of breath, higher fever, persistent fever, and even a bluish tint of the skin. So you often see this manifest just by the nature of where the virus colonizes, that you'll see these more severe progressions into lower respiratory tract infections even. So,
okay. So it is a thing, and it is potentially dangerous, but primarily for people with weakened immune systems. Yeah.
And so I think to highlight some of those examples might be useful, I think, just to kind of crystallize those a bit more. Yeah. So we mentioned infants, especially preterm infants. Children under 2 are greatly affected by this. And so actually, as a caveat, RSV is actually America's leading cause of hospitalization in children under 5 years old.
Oh, wow.
So it is quite widespread.
Okay.
Yeah.
I remember seeing somewhere that most kids, like a solid majority, 70, 80% of children have had RSV by the time they're 2.
Yeah.
But that for most kids, it's a cold functionally, and nobody knows the difference.
Yeah. I would say that's accurate.
But for some, it does get very serious and they end up being hospitalized.
Yeah. And I don't want to lose sight of some of these other higher risk groups. So
So the others.
Just to kind of finalize that. Of course, the elderly is greatly affected by this. Usually anyone over 65 years old might want to just be a little more concerned, especially if you have these certain chronic conditions. So COPD, asthma, again, things that greatly affect
respiratory.
Right.
Got it.
We have congestive heart failure, coronary artery disease. So things that as they pertain to cardiovascular health, as you mentioned, the immunocompromised population. So maybe individuals who are currently on chemo or have had an organ transplant. You know, any of those, that sort of umbrella. And also kidney and liver disorders are implicated here, diabetes, and then also neurological and neuromuscular conditions as well.
Interesting.
Plus the usual, frailty with older age is something to consider when a provider is looking at, more of a risk situation, especially if you're a candidate for a vaccination, which we'll talk about. And then also the last one would be those residing in long-term care facilities or nursing facilities.
Makes sense.
Where things it's super contagious.
Yeah.
I don't want to lose that. It is very contagious, but as you mentioned, it just doesn't always cause the most dire of side effects, dire of symptoms.
So what are the treatments if somebody has it and it's progressing past your standard cold symptoms?
So for your average adult, your average person, there are no specific treatments for RSV.
Chicken soup and rest.
Yeah. So for a lot of people, you'll see complete resolution of symptoms within 1 to 2 weeks.
Okay.
This is kind of the cut point. And as I mentioned, I do have a little bit of a lingering cough. This is one of those that you might see a cough extend past that 1 to 2 week time frame. And then more supportive care, symptom management, all the usual things that we would recommend for the common cold. So fluids, you might want to use some saline nasal spray, as the congestion can get pretty rough. Throat lozenges, medicated ones that can soothe your throat if you're coughing a lot. Decongestants, ibuprofen, acetaminophen, your usual
all the usual
cold and
suspects.
flu remedies.
Yeah.
Definitely.
Okay, so that's treatment for it. You mentioned a vaccine.
Mm-hmm.
Is that prevention? Is there something beyond vaccine? Tell me about that.
So as of this past summer, actually, there were 2 vaccines that were approved. So summer of 2023, we saw the emergence of 2 vaccines, one from GSK and one from Pfizer, I believe. So we have Arexvy and we have Abrysvo.
I'm so glad to let you butcher some names.
I mean, it's so insane.
Sounds like a duo.
It does not make any.
They do sound like a duo.
They're made by marketing teams and not for people that have to say these things often. So
yeah, I'm sure they should be required to bring that team out to talk about, all right, this is where we came up with this name. They have some deep meaning behind it. At least maybe we can get behind it.
You ask them and they're like, ChatGPT.
That's honestly,
yeah.
AI came up with this for us.
We tested it.
We put letters that can go together, but they don't go the best together.
Right.
But it still works technically.
We looked for URLs that were available and we bought the one that made the most sense.
Yes.
So we've got these 2 vaccines as of summer 2023.
Mm-hmm. So specifically, it was approved in those that are 60 years and older.
Okay.
So it makes sense just given that higher risk groups that we alluded to.
Yeah.
And actually, at this point, they're saying that the protection lasts for about 2 seasons.
Oh, wow.
So I think as we get through this season in particular, there will be an abundance of information, I think, still yet to be discussed. But I found that interesting. You might, and it's certainly, I think from month to month, you see some waning
right
in the protection of it. But in general, to have that potential is a nice thing.
And you said seasonally. So is it just standard cold and flu season, like late fall all the way through winter into early spring is when we need to worry about it?
Yep.
Okay.
Exactly. Yeah. Pretty easy one to remember. And so a lot of people are getting this now, at least what we have seen. A lot of people are getting it with their flu shot. People they've come in together to get both of those. Mm-hmm. Now there are, looking at what the CDC recommends, it's sometimes hard to get people back in for different immunizations. So just doing them on the same day is fine. But in some of these clinical trials with the 2 vaccines that we mentioned, there is the risk for, a potentiation of some of those unpleasant side effects that they go away, but you have the potential to feel sore or crappy, especially doing those together.
Makes sense.
And to that end, they have been generally well tolerated so far. Just the general adverse effects from immunizations, soreness at the site, fatigue, etc. Now, there is a small chance for some neurological side effects that I think that I've found interesting. There were some cases of Guillain-Barré reported. Now,
that's the one where part of your face goes numb and can't function, correct?
Yeah, it can be pretty devastating. Some people fully recover. Others, there's, permanent paralysis, God forbid. Again, a very small percentage, but something to note. There were some other neurological issues as well with it. But again, I stress it's just a very low percentage of the participants. And again, we'll have more of that data as this is more widely used. There also was a small potential for triggering atrial fibrillation, especially if you already have AFib. Right. Again, a very low percentage it appeared, but still worth mentioning in that same vein. Yeah. So in addition to 60-year-olds and older being candidates for this vaccine, the Abrysvo specifically, that one was actually approved in pregnant individuals, weeks 32 through 36. The thought is that, what they found is that immunity is passed on to the newborn through 6 months of age. So we have actually seen some of that as well. So if you fall within a certain, gestational age, then you're also a candidate if you want to confer some of that immunity onto to the newborn baby. A very at-risk population. So this sort of thing is progressing. I think what the CDC is even recommending at this point is not just that everybody 60 and older should get this or consider it. Right. It's that everyone over 60 years old, they're candidates, and with shared decision-making with your provider, you can decide, with your pharmacist or your doctor, you can decide if this is a good option for you. Right. So I think that that's that accurately encompasses my thought on it as well. It's certainly not for everybody. Right. But if you find yourself in a high risk situation, we know the common cold can sometimes be a little worse than that. Absolutely. So, absolutely. And the other thing I wanted to mention, around the same time as the other vaccines, an injectable monoclonal antibody was also approved. This was approved to prevent serious lung disease caused by RSV. Oh, wow. And this was specifically in babies under 1 year old or entering their first RSV season, or children up to 24 months of age who remain at risk of severe disease through their second season. And this was a preventative. Mm-hmm. It was not because I know not a treatment. Yeah, monoclonal antibodies were used as treatment for COVID and something else recently. But they're used across the board for many different autoimmune conditions. Okay. And so my understanding is that they almost consider them long-acting monoclonal antibodies. So, wow. They help the body produce the necessary antibodies, of course. Probably be a little bit out of my area of comfort to even distinguish this from the immunizations themselves. It's interesting. It's an interesting way that they, developed this. There's no doubt. So there's two of those actually. The original one that came out, it was Synagis, I believe. Okay. That was another monoclonal antibody, but you had to give it monthly. Oh, wow. And so was used a little more under specific circumstances. Yeah, high risk individuals, I think. Yeah, and it seems like something that you don't have to give every month would be more desirable. But I think more and more people are concerned, again, with this. Okay, if I have a newborn and they do have RSV, even if their infection doesn't progress terribly, right, does this leave them at risk for these other things? Yeah. Which kind of takes us into the next, the final part of the question. Yeah. What are the side effects of RSV long term? Mm-hmm. This is a contentious topic, in my opinion. At this point, there's a lot that's still being, I think, uncovered. Mm-hmm. And so as we see more with how individuals responded to the vaccine over these couple seasons, that will be useful. But in general, epidemiological data suggests that RSV in the first 3 years of life is associated with long-term respiratory morbidity, such as recurrent wheezing and asthma, decreased lung function, and possibly allergic sensitization. It's unclear whether RSV and lower respiratory tract infections cause wheezing, or if any genetic predisposition or other environmental risk factors increase the likelihood for an exaggerated response. But again, the observational, the epidemiologic data is there to say that there's something. There's something.
Yeah.
So I will say I'll just leave it at that. There's something there. There's more prospective data that needs to come out, but as far as any other major, like long RSV, how we hear that in other contexts,
right?
I'm not so sure that that's the way that they're looking at this one, at least right now. It's just more or less these breathing issues that sometimes manifest with an allergy component or whatever else. So I think that it accurately encompasses it.
Yeah. So long term, it doesn't seem like for the most part that's the case, but there are select circumstances. All right. Joni,
that was a big one.
That was a big one. Joni, I hope that helps. Big answer to a question. Hopefully it helped a lot of other people too, because that has been a popular conversation on the internet these days.
Yeah.
This one is from Denise. Denise emailed us. She emailed us questions at askjoedimatteo.com. That's questions at askjoedimatteo.com. You can ask us questions there too. But Denise said, are there any supplements I can take to help decrease my blood pressure?
The short answer is yes.
Mm-hmm.
There are. I don't believe that everybody's a candidate in doing that. I think you have to really take hypertension seriously, obviously, because as we've mentioned with cholesterol and as we've mentioned with hypertension in other contexts, it's just that persistently high resting blood pressure over many years, over a long period of time. That's what's hard to undo.
Yeah.
And you might be borderline, but you might want to be a little more aggressive in doing something about it. So again, the short answer is yes. Before we get into some of the supplements, I think we just maybe have a bit of a conversation around this question first.
Sure. And
then we can make maybe some recommendations or give them some thoughts. In general, blood pressure meds are cheap nowadays. They've been around for a long time. There are many different classes, some that, work better for some people, work better for others, some that aren't super well tolerated for you that might work perfectly for the other person.
Yeah.
So in general, I think there are a lot of good meds out there. Also, we know that other non-pharmacologic interventions, they also work. So even if you're not taking supplements, some of the biggest levers to pull in this case would be weight loss. And not just that reduction in BMI, but also, like we've mentioned, reducing waist circumference. So that kind of centralized adiposity is particularly of interest here.
Yeah.
So reduction in waist circumference can make notable changes to, systolic and diastolic blood pressure. With that comes obviously dietary interventions. And so not just a caloric reduction, but also reducing sodium intake, increasing potassium intake. Now, we could give you the milligram amounts, as we've said before, but it's nobody's really measuring to that level of granularity what they're consuming.
Right.
So in general, that's the whole thought process behind eating minimally processed foods as often as you can, because we know that they're going to be leafy greens and fruits and vegetables, they're going to be higher in potassium. Yeah. And if you're not eating tons of packaged processed foods, unless you're adding a ton of salt, it's going to be, it's going to have a very low or minimal amount of sodium.
Right.
So again, focusing on more generally on the types of foods you're consuming can help, as opposed to, I'm going to start measuring this. Now, the DASH diet has been around for a long time, has also shown that it can, lead to marked reductions in blood pressure.
Mm-hmm.
Exercise helps with blood vessel elasticity, basically. It helps with appetite control. We know that resistance training and conditioning together are even better than just doing one or the other. We've mentioned sleep hygiene. So not just the duration, but the quality of your sleep. Are you striving for 7 hours? Is there something impeding your ability to achieve good sleep on a nightly basis.
Yep.
I mean, we just listed, 5-6 things. And before I move on, we talk about sleep apnea. Obstructive sleep apnea is another big one, which in and of itself is a risk factor for hypertension.
So all of these things
are
major levers for lowering blood pressure.
They are. And for a lot of people, looking at, primary hypertension, or it might be a little bit beyond the scope of this discussion, but there are other causes. There are genetic factors. There are things that unfortunately lifestyle has a hard time addressing. It's not that you don't make those changes for a plethora of other reasons.
Right.
You don't just exercise because of blood pressure. You don't just watch your diet because of blood pressure. Again, this is just, it's making those lifestyle changes. They affect like a whole cascade of things, obviously. Right. But in general, there are a lot of people who they might see modest reduction, but they need something a little more drastic. And so that's where medications come into play. That's where if someone is kind of hell-bent on not starting a medication,
right, that
potentially, trying some sort of dietary supplement, that might be a decent idea. Again, I can't quite endorse that.
Right.
Per se, it's a little complicated. I think in general, these are consultation questions more than anything with your doctor, with Joyce, with a provider that you trust. But again, for the sake of answering the question, some of the main ingredients that we in various combinations of products that we have, the ingredients that stand out are taurine, garlic extracts, nitrate, which is usually in the form of beetroot, cocoa extract, and then again we mentioned potassium. So supplemental potassium can help people. Magnesium is another one that's often found in more comprehensive blood pressure products. So I don't really know that it helps to go through different dosing and all that sort of thing. I kind of will leave that to the individual to reach out to us or talk to Joyce.
Situationally dependent.
It is.
Yeah.
It certainly is. Again, there are options supplementally that can help. And hey, especially if you do find yourself right on the border and you're implementing some of these lifestyle changes, maybe utilizing one of these products, especially like taurine or something like nitrate that's often in, exercise or recovery products as it is.
Yeah.
You might get that dual benefit. At least, is it going to be lowering your blood pressure by 10 points? I don't know, but it might help your aerobic capacity. And that's important too. So if in any chance that you can, 2 birds, 1 stone it,
absolutely.
Then that's great too.
So if I heard you right, because Denise is saying, are there supplements that I can take to help decrease my blood pressure? The implication is Denise has high blood pressure and she wants it lowered and she's trying to avoid medication. And just to sum up what you said medications work and they're effective and they're cheap, but so does exercise and diet control. Those are and general reduction of adiposity, primary waist circumference. Those are huge levers. If you're trying to avoid medication, start there. In addition to that, if you want to supplement, here are some options, but that's kind of the order of operations there.
Yep.
Makes sense. And I love that. I think there is, that reminds me a lot of your dad, that get your diet right, get your exercise right, then we can supplement, then we can take pharmacological steps if we need to.
Sure.
But don't be afraid of them. They're there to help. And that's the point. And the other thing you mentioned, I think that's really important, is it is the amount of time, the time that your blood pressure is high is just as relevant as how high it is, right? It's that you had high blood pressure for a long period of time as well.
Right.
Because everybody's blood pressure gets spiked when something stressful happens or whatever.
Right.
But it's when your blood pressure is high for an extended period of time.
Resting blood pressure.
Yes.
Exactly. That's a critical distinction. You're stressed and you're exercising, your blood pressure is going to skyrocket at times. And we know that doesn't, portend any sort of untoward issue.
Right.
Right. If I said that correctly, but
you did. You did. Those were $5 words there. Well done. Steve emailed us a question via questions@askjoedimatteo.com. That's questions@askjoedimatteo.com. You can still email us there. Steve is a little bit longer. This is a fun one. Steve said, I am a 69-year-old man. I keep very active by going to the gym 5 or 6 times a week, doing both resistance training and a decent cardio regimen. Well done, Steve. I've been purchasing Perfect E and Liver Essentials Plus from you guys, and I've been very pleased. I use prescription Mobic for joint pain in my shoulder and hands. I also take 1,000 IUD of organic turmeric every day. Any recommendations to further help my stiffness and joint pain? What you got?
So this would be one that I have curiosity about, more specifically what joints are stiff. Is it your knees? Is it your wrists? Is there, in general, sometimes stiffness it might be worth investigating further. There's always the off chance that there's some sort of rare issue underlying this.
Mm-hmm.
Is it more of a, could this be rheumatoid arthritis, something in that umbrella of issues? So not to overlook anything a little more serious. But in general, like how does this manifest? Is this just when you wake up? Does it feel better when you start moving around?
Yeah.
Is it when you squat low? Is it when you deadlift the bar?
I don't know what you're talking about.
Oh no. It was going to come up at one point.
Look, this is a serious question for Steve. We can talk about my issues later.
But yeah, it's like, how does exercise change his experience of joint pain or stiffness?
Right.
So,
because he's doing it.
Right.
Props to you, sir.
Right.
Keep it up.
Exactly. There are always kind of levers to pull, to use that reference again, especially if he's working out 5-6 times a week. There's probably things that can more or less change, some of the stiffness, the joint issues, the pain that he's having.
Yeah.
Exercise selection what about the dose? Did you start something new in this sort of spiraled out of control? Or is this just like, hey, I'm getting a little bit older and it's always been my knees and it's a little more on its face, just looks like an osteoarthritis kind of thing.
Right.
In that case, he's already doing some turmeric. He's on prescription Mobic or meloxicam, which is an NSAID.
Okay.
So some overlap with those things. I would urge a bit of caution in using them together, especially at a little bit of higher dose. But in general, if he hasn't had any issues up to this point, no,
he's probably okay.
Yeah, it's hard to say.
Just be aware that is a potentiality.
Yeah, in meloxicam, it seems, just at a quick glance of some of the literature, I don't know that there's a ton of meloxicam research being done at this point, just given that it's been around forever.
Mm-hmm.
But when this was formulated, they had the goal to make it to hopefully have less of the side effects that they were seeing with the more, with certain NSAIDs that were available at the time. Diclofenac being one of them, ibuprofen, naproxen, some of those that are a little more likely to cause GI issues, GI bleeds, ulcers,
mm-hmm.
that sort of thing, cardiovascular issues that are concerning. So if the meloxicam is kind of helping him on a daily basis continue to move and do the things that are helping him, that's great. I always have a little bit of concern for long-term NSAID use. I think if you could somehow move the needle for people to more on an as-needed basis, more sporadically, mixing in the turmeric as opposed to just doing everything at once. Maybe mixing in some Tylenol. Again, changing some of or looking a little more closely at some of his exercises that he's choosing. But he could also do a more comprehensive product like Inflamove. Okay. So it has a little less turmeric, but there are some other anti-inflammatories as well that seem to, again, help people use less of the NSAIDs and also keep them moving. So is it going to change completely change the landscape of your osteoarthritis? Probably not. But again, it's just keeping you active, getting out of that mindset of, wear and tear got me here. This is my fault. My joints are wearing away. You just got to do enough to manage the symptoms, but just try to keep moving. Yeah. There are other over-the-counters that can be used. I mentioned acetaminophen, and then also there are topical NSAIDs. So ones that you're not, absorbing systemically to the extent that you would when taking the oral formulation. So topical diclofenac for joint pain, joint stiffness. that can help people, when they go start exercising
Yeah,
or whatever.
yeah.
It's just, maybe it's the ritual of it too.
Yeah.
My knees kind of hurt when I play racquetball. I kind of like putting on this benign diclofenac gel when I
Right.
go out and play. So it's often a multi-pronged approach, but sounds like he's doing all the right things. I would just hate to see him become less active because of this.
Right. Don't stop.
Yeah.
That's the punchline. Keep going. All right. Wow. Man, these questions are always so much fun because they always, to me, the not pharmacist, I look at it and I go, I'm sure there's a simple answer to this. I'll just make sure that we get asked this question, and then you go in deep and I learn so much. So I hope that helped you folks listening. Thank you for giving us the details on all that. I really genuinely appreciate that you don't answer these questions at a surface level. You always take it a little bit deeper so that people have a better understanding of what's actually going on. I think that's huge.
Thanks.
And it seems like you take it to a deeper level when you're holding one of your cats.
Yeah, that helped. That helped kind of take things to the next level today.
I don't think it did. I think.
And we didn't get to talk about your lower back and what happened. So what happened there?
Yeah, let's take this time.
Before we
because
say goodbye to all of our listeners.
Yeah, we can take
all
this
of our
time
viewers.
to plug something that we're working on.
We can
Something that's
tease.
hurting. It's hurting people.
It's causing a lot of pain. It's literally putting blood, sweat, and tears. What are we doing, Dante? No, it's
So
good.
before we set up for the show, we've been taking the time to do a little exercise beforehand. But not just that, we are trial running more or less a beginner exercise program or template that can really help get somebody started who doesn't know where to start and kind of just they're ready to press play, but they don't know what exercises they should be doing. They don't know how much. They heard about the 150 minutes of moderate intensity aerobic activity, and they heard about 2 times a week of resistance training. But I don't want to do that. I want somebody to lay it out for me and progress it for me and help me get started. I don't want to worry about the details yet. As I get better and as I understand more of this, then I can do my thing and I can become more autonomous with my health and fitness. But right now I need somebody to guide me.
Yeah.
And so that's what we're working on.
Yep.
And so what's been really interesting is we're about 3 or 4 weeks in, and we're really excited to start filming, and we're really excited to start exercising. We got the music going, getting set up, and Tyler is hunched over in pain after starting some of his deadlifts. So
First deadlift. First one.
So what happened?
Well, I have a back thing that every once in a while it just decides to not be happy. I used to think it was because I had bad form or that I didn't exercise enough, but I am a year and a half into consistently doing deadlifts, and I've had lots of great hands-on coaching. I know that it wasn't my form. It just acted up and decided to be unhappy. So
what did you do? Did you give up?
I did.
Going?
I cried a little bit. I rolled around on the floor. We have footage.
We do have footage.
Yeah, we may have to.
We should just cut to it right now.
Yeah, I know. I did feel badly about what happened, but I think that you made I think we could have even made further adjustments to keep the session going, but being a little pressed for time, it was tough. But I think you kept moving. You just moved around a little bit. You still did some upper body work.
Absolutely.
And so it's still,
I pivoted.
What would have maybe been kind of a catastrophic day a year or two ago.
Yep.
Was less devastating.
Oh, completely. Yeah. No, this isn't going to slow me down at all.
Right. And so we don't want this to hurt your back.
No.
But when that stuff invariably happens, it's how do you, where do you go from there? And I think that this program sort of allows for some customization, even though it's more or less a template. But it'll equip you with the knowledge to say, you know what, that tweaked my back today, but there's still these 3 regressions.
Yep.
There's still these 3 movements, or there's this other thing that's not hurting me right now that I can keep doing. And I can still feel, because ultimately at the end of the day, you want to punch the clock and you want to feel productive. And I think there was still some benefit from just doing it.
Oh, 100%.
So
yeah. I'm not going to, I don't want to lose the momentum that I have
Uh-huh.
because my lower back hurts.
Mm-hmm.
So I'm going to keep going. I will be at the gym tomorrow morning and I will just change what I'm doing, which is what this program is set up to be able to do is, okay, I can't work that particular muscle, but there's other muscles that are worked in that movement. How can I hit those other muscles? I'm going to make some changes and keep going.
Yep. And the other thing that we didn't touch on that might be nice to mention in this context is that Tyler is a bit of an overachiever. And so he's not just doing this program. He's also he's trial running what we have, which is 3 days a week.
Yes.
Plus some conditioning, not to give away too much at this point. We still don't know what exactly it's going to look like, but
right.
He's doing that. Plus he's still doing some of his more bodybuilding based stuff. And I'm never the person to speak in absolutes. So I think that some of what's happening with Tyler is that there's a mismatch potentially with the dosing of training. And so you don't want to always be in a position where you're substituting an exercise because something hurts.
Right.
You want to eventually get to the point where if this is a continual problem,
right,
that you say, there are things that I can do to kind of better match where my fitness or what the amount of time that I have or whatever. So that's what's hard about kind of running two separate goal programs at the same time.
Yeah.
We see that. It's a good learning experience. Now, who am I to say that that's what caused it?
Right.
But I think that that's having been through a lot of this.
Yeah.
You may not realize that, okay, so that what you're doing with this foundational program has a hinging movement twice a week. And in your case, you're doing some deadlifts twice a week. Now there's probably some hinging in your other program. There's probably something that's fatiguing your hamstrings. There's probably something that's fatiguing your quads. And so it's this culmination of things that you're probably doing a level of volume that just may not be exactly what you need right now.
Fair enough.
I mean, who am I to say? I just think it's worth.
And I haven't said anything at all.
My trainer.
I haven't said anything at all because I am not currently in the beta test program right now. So like most of you, I'm thinking, wow, this sounds really exciting.
Yeah, I can't wait to hurt myself like Tyler did.
No. This sounds really great. This sounds exciting.
It is.
It's in beta test. Test.
Yep.
When are you going to start?
Now is a good time.
Now is a good time.
Yeah. And we have some people also testing it out. They're doing it in their house. They're doing it in their living room. They have limited equipment.
Yep.
They have limited time. They have limited access to huge gym facilities. So if that sounds like you, then maybe
stay tuned.
Stay tuned.
Stay tuned.
There's plenty of back pain to come.
Yeah.
I framed that in a way that I wouldn't have framed with a client. I kind of came at you a little bit. I said, Tyler's an overachiever. He's doing 2 programs, but ultimately on the record, we could say, if I were you, I would just look at your bodybuilding thing and I would say that I'd probably cut out any hinging and I would watch the volume of the other lower body stuff you're doing, because when you're doing more multi-joint compound exercises, the squat, the deadlift, you're using so much of the musculature,
right,
that sometimes you can overlook the fatigue cost of the other little things that they seem little.
That's what I'm absolutely going to make sure that I'm not doubling up on anything on the off days.
And eventually as your fitness adapts, you very well may need more quad stimulus. You may very well need more hamstrings. You may want more. Yeah. But it's just a matter of, okay, I learned that today there's something in there's a ether, line. And now we just we
bottom
dance
line,
through it.
Practicing what you preach.
That's
Appreciate
it.
Guys.
That's right.
Appreciate it.
All of the products that we mentioned are available on our website. That is askjoedimatteo.com, askjoedimatteo.com. That site is also where you can sign up for the mailing list, find out about new things being on sale. You can find past episodes of this show, or you can find the show that started all of this, the Ask the Pharmacist show, available on that website forever and ever. If you have any questions, please email us, questions@askjoedimatteo.com. Show notes, any of the articles we referenced will be available down in the links in the show notes. And if you learned something, or you enjoyed this show, or you know somebody who needs to hear it, please share it with them. Like the show, give it a thumbs up or 5 stars or whatever you can to say that this is a good show. Leave comments and questions. One of these comments or one of these questions that we answered today came from a YouTube video. Somebody mentioned or asked this question on the video. We're answering it for them. So any of that stuff, throw it down in the comments. We love to hear it, and we respond to every single one of them. Big thanks, as always, to Josiah Schweinberg, our engineer, Michael Deppish, our editor, Joyce Gibb, our nurse practitioner, who handles private consultations. We've got Diane Silverman, who does product, Terry, who does scheduling, Cecilia, who does distribution. That's Dante DiMatteo, and my name is Tyler Andrews. Thanks so much. We'll see you guys next week.